We go ahead and we kind of tell about how people are aging by checking their levels of FSH that they make in those 2 or 3 days around the time when it's over the levels of LH. And we call that cycle day 3 ovarian reserve testing. So you can see here, women that can bring up an egg with an FSH less than 10 are actually in the best prognosis group. If your brain has to make more FSH greater than 10 milli-IU per ml, then we know that that egg is older and more resistant. As you get clinically older, then the amount of FSH increases. So this is a chart I like to share with my patients. Women have their peak fertility when they're 18 to 25. When you're a 25-year-old, you can conceive about, the chance of getting pregnant is about 35% per month. Because those eggs are young eggs and they have the right number of chromosomes, the miscarriage rate's only about 10%. So the overall live birth rate's about 30% per month. So if you have your peak fertility at 25, if you do nothing more than just to get to be older and you're 35, your conception rate goes down to about 20% because you ovulate your best eggs first. The ones that remain have more chromosomal defects. It takes you longer to get pregnant, and then when you do get pregnant, because the chromosomes are more likely to be abnormal, you have a higher rate of miscarriage. So the spontaneous conception rate is down to 20%. The miscarriage rate is 1 in 4. So the overall live birth rate per month is 15%. So you go from 30% to 15%. And as you get older, I usually use 40 as my next signpost. When you're a 40-year-old, you're down to 10% per month, 40% of the pregnancies miscarry, the overall live birth rate is 6%. Correspondingly, your body makes more and more FSH as you get older to bring up that older egg. That's also why when you conceive at 35 on your own and you're making more FSH, you're more likely to bring up 2 eggs. That's why after 35, there's a greater chance for twinning, spontaneous twinning, because you're making more FSH to bring up those older eggs. But we use 35 as the cutoff point. 35 is critical. If you're, like I said, if you're going to be at this lower success rate, 15% per month, it's silly to go ahead and wait for 12 months. We want to see you after 6 months. So we use to kind of also gauge how people might actually stimulate to medication. We use an AMH level, and usually we want that AMH level to be about 1.5 to 2. This usually means that you have AMH is made from granulosa cells which invest the eggs. The more eggs you have, the higher the amount of AMH. So basically it's kind of like a linear relationship. If you have a really low AMH, we know that you're aging faster and that you may not have as many eggs within your ovary.